Emergency Contraceptive Pills. Everything you need to know. Welcome to our channel. Today we're diving into a crucial topic. Emergency Contraceptive Pills. Whether you're looking for information for yourself or someone you care about, this video will cover everything you need to know. We'll break down what they are, how they work, and who should consider using them. We'll also address common concerns and potential side effects. It's important to remember that this video is for informational purposes only, and doesn't substitute for professional medical advice. If you have specific questions or concerns, please reach out to a healthcare provider who can give you personalized guidance. Now let's get started. Let's start with the basics. Emergency contraceptive pills or morning after pills prevent pregnancy after unprotected sex or birth control failure. They delay ovulation, stopping sperm from meeting an egg. There are two main types, levonorgestrel, Plan B, and ulipristal acetate, ELA. They are not abortion pills and won't work if you're already pregnant. Most effective within 72 hours, but can be taken up to 5 days later. The sooner you take them, the better they work. Let's discuss when you might need emergency contraception. It's a safety net for unprotected sex or contraceptive failure. Maybe the condom broke, or you forgot protection. It can also help after sexual assault. Reach out to a healthcare professional for support. Let's talk about what to expect after taking emergency contraceptive pills. Most women experience mild side effects, if any at all. Think of it like your body adjusting to a sudden hormonal shift. Common side effects include nausea, fatigue, and headaches. Some women also experience breast tenderness, dizziness, or changes in their menstrual cycle. These side effects are usually temporary and tend to go away within a few days. However, if you experience severe abdominal pain, especially on one side, it could be a sign of an ectopic pregnancy, which is a medical emergency. If you're concerned about any side effects, don't hesitate to reach out to a healthcare professional. It's also worth noting that emergency contraception pills don't protect against sexually transmitted infections. If you've had unprotected sex and are concerned about STIs, get tested as soon as possible. Chapter 4. Who shouldn't use emergency contraceptive pills? While generally safe, emergency contraceptive pills aren't for everyone. If you're already pregnant, they won't work. Avoid if allergic to ingredients. Discuss with your doctor if you have medical conditions. Chapter 5. Short-term consequences. What to expect. You might be wondering about the short-term consequences of taking emergency contraceptive pills. The good news is that they're generally minimal and temporary. The most common short-term consequence is a change in your menstrual cycle. Your next period might start a little earlier or later than usual, and you might experience some spotting or breakthrough bleeding between periods. These changes are usually nothing to worry about and should resolve on their own. Some women experience breast tenderness or mood swings after taking emergency contraceptive pills, similar to the symptoms you might experience before your period. Again, these are usually temporary and should subside within a few days. It's important to note that emergency contraceptive pills are not intended for regular use as your primary method of contraception. They're designed for those occasional oops moments, not for ongoing pregnancy prevention. Chapter 6. Debunking myths, long-term consequences. Let's address the elephant in the room, long-term consequences. There's a lot of misinformation out there about emergency contraceptive pills, so let's set the record straight. To be crystal clear, there is no scientific evidence to suggest that taking emergency contraceptive pills will impact your future fertility or increase your risk of health problems down the line. They have been extensively studied, and numerous studies have confirmed their safety. Emergency contraceptive pills do not cause abortions, birth defects, or future infertility. These are harmful myths that can prevent people from accessing safe and effective contraception when they need it most. If you're ever unsure about the information you come across, always rely on credible sources like your doctor, a pharmacist, or reputable medical organizations. Chapter 7. What happens in case of overdose? We always need to talk about safety, and that includes what to do if you accidentally take more than the recommended dose of emergency contraceptive pills. First, don't panic. While it's not ideal, it's unlikely to cause serious harm. The most likely outcome is an increase in the severity of side effects. You might experience more intense nausea, vomiting, or dizziness. In this case, it's best to contact your doctor or a poison control center for guidance. They might recommend that you drink plenty of fluids and rest. In rare cases, they might suggest going to the emergency room, especially if you experience severe vomiting or dehydration. Remember, it's always best to follow the dosage instructions on the packaging and contact a healthcare professional if you have any concerns. Chapter 8. Possible complications. When to seek help. While complications from emergency contraceptive pills are rare, it's essential to be aware of the signs and seek medical attention if necessary. As we mentioned earlier, severe abdominal pain, especially on one side, could indicate an ectopic pregnancy, which is a life-threatening condition. Another potential complication, though extremely rare, is a severe allergic reaction. Signs of an allergic reaction include difficulty breathing, swelling of the face, lips, or tongue, and hives. If you experience any of these symptoms, call 911 immediately. It's important to remember that emergency contraceptive pills are generally safe and effective when used correctly. However, like any medication, there's always a slight risk of complications. If you experience any unusual or concerning symptoms after taking emergency contraceptive pills, don't hesitate to seek medical attention. Outro: stay informed, stay safe. Thank you for watching. We hope this video has provided you with valuable information about emergency contraceptive pills. If you have any questions or need further advice, please consult with a healthcare professional. Remember, knowledge is power, and understanding your options when it comes to reproductive health is crucial. Don't be afraid to advocate for yourself and seek out accurate information from reliable sources. Don't forget to like, share, and subscribe for more informative content.